me to think about in one step. So actually, I wasn't really interested in medicine or surgery. The first thing I wanted to do when I was a kid was to actually build nuclear bombs and blow up the world. So that's where my interest was. I was going to be a nuclear physicist. And then sort of further along the track, I just wanted to sort of build things. So I decided I was going to be an engineer. And so that was most of what I thought of in high school, I guess. And yeah, I guess, I mean, these pathways just happen, I guess. And so I actually applied to go to engineering. And I guess two things happened. One was that I wanted to go to RMIT because I knew it was very hands-on. But the headmistress of the school, the boarding school I was in Ballarat, was horrified and said, "You're not going to RMIT, you're going to Uni Melbourne." And then arranged with her cronies for me to be taken on, a VIP tour and why I should go to, Melbourne Uni and, blah, blah, blah. So I started it. It was the most antiquated course. I learned how to make paper planes and flying cylinders and, all that sort of thing. But, it was just so theoretical and, I was just unhappy and I really didn't know what I wanted to do. So I dropped out, became a waitress, as one does, and then thought, well, I probably have to go back and do something. And then I thought, well, I got the marks for medicine, so I'll go back and do medicine, because, you don't know why you're unhappy at that stage, and you're not really a deep thinker at the age of 18. So, I reapplied and got into Monash medicine. I hated it. So, but I thought I better finish something. So I didn't really, like medicine until getting, well, actually pathology was really what got me in. I really enjoyed pathology in fourth year, dabbled with the idea of becoming a pathologist. And then I just really liked the practical patient side of things. And then, as I went along, it became clear that, I was too impatient to do medicine and stand around pontificating about different things. Although, the cerebral, aspect of it was sort of good, but I still wanted to sort of fix things. And, surgery seemed to be doing that. And I guess, the further I got in, it was really in as a second year JRMO, when I got the opportunity to be an orthopaedic registrar, I was happy as a clam, just, thinking I could just fix things. And, so that's when it really, I guess, started for me for orthopaedics. So I'm sort of so I didn't, decide that's what I wanted to do from, the age of 2 or anything like that. So in terms of obstacles, I can't really say I faced a lot of obstacles. I know, as an intern, I had one rheumatologist when I said, I think I want to be a surgeon, and he just sort of looked down at me, and said, "I think the market forces are against you." Then there was the general surgeon at Moorabbin who sort of just laughed at me and didn't take me seriously. But they didn't sort of, put me off. They were just general conversations, and I guess they were just thinking, oh, well, what do you want to do? Well, I was thinking of surgery. They made a comment and that was it. So nothing sort of really put me off and nothing, got in my way. And, I just met so many people along the way who were so encouraging. And, in terms of surgery, I then went to a third year RMO position at the Alfred, because that was the time I was at Prince Henry's, and Prince Henry's was about to shut. And I thought, well, there goes my surgical career if I don't go to the Alfred. And I loved all the rotations that I did. And I must admit, all of them encouraged, come to neurosurgery, come to, plastic surgery. And I really had to think about, well, was it just the team that I loved working with, or was it the fact that, yes, I could do a NOF every day, but I certainly couldn't do a craniotomy every day. So, they're the sort of things I guess you think about along the way, because you won't always work with the same people. So, I've been lucky. All I've received is, encouragement and support. And I guess, I haven't really had, I've had obviously a couple of main mentors who have sort of helped me. But I've really had helpful advice from a lot of people. And I think what you find with mentors and a good mentor, I think, is that they just listen to you and make you think rather than actually giving you advice. And I say that to a lot of people I speak to, and I might only speak to them a couple of times. I say to them that the best thing about being able to speak to somebody at that level is, in fact, for you to just saying what you think, out loud, because in the end, only you can make that decision. I can't hop into your body and know exactly what's important to you. So I've been lucky. I've been able to to follow the things that I really liked, and been encouraged in them. And certainly, there's no doubt, opportunity plays a role as well. Oh, I would have told myself to go and do RMI engineering and not be swayed, at school, and go and do engineering at at the University of Melbourne, because I think, though, when I think back, it probably wasn't a wasted year, because I think I grew up a lot. Just a bit of maturity of thought. Because I grew up in the country in Sonana, small country town, 3,000 people. Then I went to boarding school, and then came down to the big smoke, so to speak. And, so I think it was, it was probably a good thing in the end that it happened like that. So, no, I think I may well have still ended up in the same place. I mean, I don't know whether I would have liked that engineering course, but I may have possibly ended up in biomedical engineering. Though the real thing I really wanted to do eventually was chemical engineering. Because that was just a bit more cerebral, I think. Of course. Oh, at the moment, I guess it's mainly my family. I've got 4 kids, age 18 to 24, and I mean, they're really grounding and great fun most of the time. I did sort of have a midlife crisis about 10 years ago and bought a motorbike. Unfortunately, I got T-boned and rode off the bike, and I never got back on. And that wasn't because I didn't want to get back on, but because we were doing house renovations at the time, so the money was due to be spent there. But I feel a second midlife crisis coming on. So that would be, something that would be nice to do. But I'm sure, you find the same thing too. Your weekends and that just go rapidly by the time you think about family, by the time you think about, lots of the other pro bono interests, that one might have, such as, teaching on RACS courses, doing examining, sitting on boards, and then of course, any on call that you've got to do. But in terms of simpler pursuits, I like doing cryptic crosswords and Sudoku, and I must admit I do like Candy Crush. It's very satisfying blowing up those candies. Yeah, I think that sort of probably harks back to my childhood of wanting to blow things up. And I guess if I had a bit more time, I'd like to do a bit more fishing and stuff like that. But at the moment, pretty jam packed. And look, it's busy, but I guess not too unhappy about that. I guess in terms of learning, my most memorable patient was a woman who'd gone camping with her husband, and a tree fell on their tent, during the middle of the night, and it was very windy, and one of the big tree branches actually pierced her perineum, and she essentially had a almost well, the spine wasn't open, but she had a fracture dislocation of L5S1, as well as big gaping hole and abdominal perineal injuries. So this was when I was at the Austin. It was my first year as a consultant. I had never seen a true fracture dislocation of L5S1, nor even dealt with such a awful sort of open injury. Lovely patient, and she probably got every complication, and I came back as a spinal surgeon then, sort of, primarily, and she had virtually every spinal complication that you could ever see or not want, rather than want. And a lot of advice. So I was seeing her every day for 9 months. She was in hospital, and there's no doubt she had a horrible injury, but no doubt it sort of taught me a lot about complications. It taught me a lot about reaching out to colleagues and trying to get experience, vicarious or not. And it also taught me that you can get back to a very useful life, even after such a devastating injury and such a rocky course that she had. And you probably remember. I think people ask me which is the worst year. I think the first year as a consultant is your worst year, and then after that, I put your intern year is probably your second worst year. But I followed her for a long time. Unfortunately, her paraplegia actually extended, because she's probably one of the only patients, again demonstrating that she got every complication known to man, actually started to go up northwards. And the last time I saw her was actually going up, into her arms, due to this, traumatic syringe. But, before it did, she took up painting, and she, painted me a lovely picture of what she thought my two daughters, at the time, who were babies, because I think I was treating her when I was pregnant with number. No, it must have been number one, because I came back from fellowship pregnant. Yeah, and she gave me this painting, which I've got on the up on the wall. And then other patients, I remember there was another chap who had terrible neck pain. He had a unilateral facet dislocation. He put up the pain with for quite a number of years. We talked about operation often. It was front and back surgery. We went through the risks a number of times, and I think finally after 5 years, we were both comfortable enough to go ahead with it. And unfortunately, on day 2, he had a sudden obstruction and died. And that was just absolutely heartbreaking. And I was thinking, oh my goodness, this patient and his wife, put their utter trust, in me. How could I, and you go through this great period of trying to I guess, analyze yourself and what you're doing, and sort of, going back on those sort of things, but it does teach you a lot about yourself, and I guess the practice of surgery, that makes you realize how much your own experience makes a difference to how you treat people in the future, which is, I think, actually very important, because I think it's when you stop thinking about those sort of things that you probably stop being a good doctor. That was a difficult question. And then I realised that, I do have a favourite book, and it's called The Tao of Pooh. And I've been thinking that I should rewrite, in fact, The Tao of Sue. Now, The Tao of Pooh is a book by, what's his name, Benjamin Hoff. And Winnie the Pooh, and what sort of bear he's like. I guess it's a bit Forrest Gumpish, but it's really an introduction to Taoism. And it's really quite, simplistic. And I guess he uses, some stories. He presents it as Winnie the Pooh, and, he's, talking to, Christopher Robin, or talking to Piglet about, different things. And it's a really simplified, I guess, introduction to Taoism. And that's not to say that, I'm a full-blown Taoist or have had time to look at it, but that is something I would really like to, I guess, study a bit more when I get the time, because I guess a lot of my philosophies on life, are that, things always turn out for the best, in terms of things happen for a reason. Now, I'm not a complete, fatalist, and maybe that's just, the way you should think about things. But, there's, I guess, certain phrases that I always trot out to people who, by some quirk, decide that they want to talk to me about, disappointments in life, are often not so disappointing when you look at them in the future. And the other thing about making decisions is that, once you make the decision, obviously you feel, better for it. But even if you think it may have turned out to be the wrong decision at the time, when you look back on it, it's amazing how often, it wasn't the wrong, decision. So, the Tao of Pooh is about trying to find that contentedness, of your own thought, or that's the way I interpreted it, in your life.